大家好，我叫 John Harry，来自巴基斯坦的学生。我今年25岁。我2013年来中国学习。我在湖南师范大学学医，我的专业是学医。我现在在湖南省人民医院学习和实习。我获得了湖南省奖学金和湖南师范大学外国留学生奖学金。我跟外国学生上了医学课，我讲的课是自主学、生理学、病理学和生物化学。我在中国跟小孩子们讲英语课。我上英语课的学生从3岁到16岁。我在湖南省人民医院和长沙中心医院跟护士们和医生们上英语课。好，谢谢大家。Good morning, dear viewers. I'm your host, John Harry. Dear viewers, today we're going to discuss about the lung diseases. As you know that the lung diseases are not only common in the developing world, but they are also very, very common in the developed world. Now, why these lung diseases are common all around the world? I mean, what are the common factors? What are the underlying factors for such kind of diseases? And how we can treat and manage such kind of diseases? And how we can prevent ourselves from such kind of diseases? To answer all these questions, today we have invited Dr. Villa in our studio. Dr. Villa is a respiratory doctor, and she's working in Hunan Provincial People's Hospital as an attending doctor in the respiratory department for almost last 8 years. Good morning, Dr. Villa.
Morning.
How are you today?
I'm fine, thank you.
Okay, thank you very much for your time to be here with us.
It's my pleasure.
Now, Dr. Villa, my first question is, what are the most common respiratory diseases in your department?
The most common disease in our department is COPD, you know.
COPD, okay.
The COPD is chronic obstructive pulmonary disease.
Okay.
Now, it is the fourth leading cause of morbidity and mortality, but it is expected to be the third leading cause of death by 2020.
So you mean that the COPD is the most common disease in all around the channel almost?
Yes,
Yeah?
a lot of people suffer the disease.
Okay. Now, can you please briefly explain why the people suffer from this COPD? I mean, what are the underlying causes for to develop the COPD?
Many things can cause the disease.
Okay.
So, such as the tobacco smoke,
Okay.
and the air pollution, and the indoor-outdoor air pollution,
Okay.
and the occupational dust chemicals.
Okay.
And so, but I think the most important things is the smoking.
Smoking, yeah.
Yeah, and the content and the cigar,
Okay.
and cigarette, pipe, and any other types of smoking popular in many countries.
Okay. So you mean many factors cause the disease, but smoking is the most important single factor, yeah?
Yes, because
Okay.
it can damage our airflow,
Oh.
and the damage is irreversible.
Oh,
Yeah.
I see. So once the damage is done over there, we cannot reverse it, yeah?
Yes, yes.
Okay, that's great. Now, can you please briefly explain, once the patient suffers from the COPD, yeah, how he know that I'm suffering from the COPD? I mean, what are the signs and symptoms for such kind of patients?
When a patients come to a department,
Okay.
they will tell me that, doctor, I have the symptoms of dyspnea. And
Dyspnea.
initially, only on the habit exertion,
Okay.
and but the conditions progressing, it can occur at rest.
Okay.
They also have the symptoms of cough, the cough, yeah, the chronic cough,
Okay.
sometimes with sputum.
Okay.
Yeah. So if they take some physical examination,
Physical examination, yeah?
for
Okay.
patients,
Okay.
we will find the chest pain
Okay.
or the decrease the chest movement
Okay.
and have resonance.
Okay.
Yeah.
So you mean that if the patient suffer from this disease, the most important symptom he develop is the dyspnea, means
Yeah.
difficulty in breathing, yeah?
Yeah.
He cannot breathe very easily, yeah?
Yes.
Okay. Difficulty in breathing, cough and sputum, yeah? is these symptoms are continuous or intermittent?
Oh, maybe I think it's intermittent.
Intermittent, yeah.
So if the patients catch a cold
Uh.
or have a serious pneumonia,
Okay.
and the symptoms will be obvious.
Oh, okay. So
Mhm.
symptoms become more severe, yeah?
Yeah.
With other diseases, yeah?
Yeah.
Okay. Now, once the patient suffers from the COPD and he reached to your department, yeah? Let's say non-provincial people hospital respiratory department, yeah? Now, how you manage such kind of patients?
Oh, so and according to available evidence,
Mm.
I will prescribe some medicine for the patients.
Okay.
And it contains bronchodilators combined the corticosteroid.
Okay.
So it can relieve the symptoms of patients.
Okay. Okay.
So.
Okay, but some kind of patients are very severe, you know.
Uh-huh.
Some kind of patients are very severe. I mean, they cannot breathe very easily, yeah.
Yeah.
And they are in very severe condition, yeah.
Yeah.
So what do you do for these severe patients when they reach to your department?
Oh, at first I will arrange some investigations or taste them for the patients.
Okay.
So such as the CT scan, arterial blood gases.
Okay.
So if the patients have type 2 the respiratory failures,
Okay.
we will use or arrange the mechanical ventilation to help
Okay.
people breathe.
Okay.
Okay, it can relieve the symptoms of patient.
So you mean that when the patient suffers from the COPD, yeah, he can lead to the respiratory failure, yeah?
Yeah, that's the very common complications of the disease.
Okay, okay. He need to respiratory failure, yeah? He go to respiratory failure.
Yeah.
Okay, okay. Thank you very much, Dr. Villa, for your explanation. Dear viewers, as you have seen that Dr. Villa have explained the COPD in a good detail. Now Dr. Villa will take us to the respiratory department and we'll see the real patient of the COPD and we'll see that how this kind of patient suffer from such kind of disease. Now have a look at that. Stay tuned. Welcome back, dear viewers. Dear viewers, now we are in the respiratory department in the ward with the Dr. Villa. And Dr. Villa is going to show us the COPD patient and she's going to explain what is the condition for this COPD patient. Welcome back, dear Dr. Villa. Can you please explain a little bit about this patient?
Okay, the patients and is the COPD patients.
Okay.
They has been living in our hospital for several times.
Several times, yeah?
Yeah.
Okay.
They had the disease for 6 years.
6 years.
Yeah.
Okay.
And they also have the symptoms of the chronic obstructive, the chronic cough.
Okay.
And cough was filtered.
Okay.
And the color is yellowed.
Okay.
And they have the breathlessness.
Okay.
And the most important thing is they had a serious complications of the type 2 the respiratory failure.
So this patient now had the type 2 respiratory failure, yeah?
Yeah, they need
Okay.
the mechanical ventilation, you see.
Okay, so this is the mechanical ventilation
Yeah,
for the
it can
respiration.
help people breathe and
Okay.
relieve the symptoms of the patients.
Okay, okay.
Yeah.
That's great. So how long this patient have been using it?
2 years.
2 years.
Yeah.
2 years he's using this before, yeah?
Yeah, we
Okay.
will arrange the arterial blood gases to evaluate the conditions of patients
Okay.
and adjust the index.
And just the index for how long he need to use this more, yeah?
Yeah.
Okay, okay. Dear viewers, as you have seen the condition of this patient, that this patient have developed a respiratory failure because of the COPD. Now by looking at this patient, you can imagine how much pain this patient has been suffering. Now it's your responsibility to take care of your health and of your loved ones. Now if you don't take care of your health and if you don't quit smoking, very, very important, if you don't quit smoking, you can also bear the same kind of consequences like this patient. Now it's your responsibility to take care of your health and around your loved ones. Now if you have any question, any suggestion, you can email us. Today we're going to finish here. See you next time with a new topic. Till then, take good care of yourself and your loved one. Stay tuned. Have a good day. Bye-bye.